Hello, everybody. Welcome to our podcast style community project for the UCLA course titled The Disease Mechanism and Therapies. So, we wanted to try this method of delivery to hopefully reach more people, to reach those who just want to learn more but may not have the time to sit and watch a video, or who are simply on the go. But we do have some visual aids for those of you who are actually watching the video. They're just helpful but not necessary. So, let's begin by introducing the team. I am Adia, a senior MCDB student.
I am Melissa, a junior MIMG major student.
I'm Xuanting, a senior MIMG major student.
And as part of this course, we have learned a lot about Duchenne muscular dystrophy, which is also known as DMD. So if we say Duchenne muscular dystrophy, DMD, Duchenne, we're all referring to the same thing. And we all learned about this disease, but not a lot of people in the general public know about it, or are even talking about how DMD patients are doing during the pandemic, which is why we decided to focus on this for our community project. So it is my pleasure to present to you our podcast episode for today, Living with DMD During COVID-19. Yeah, yay.
Yeah, I know there are plenty of people out there who are unfamiliar with DMD and maybe wondering what exactly that is. For those people out there, Adia, can you explain what Duchenne muscular dystrophy is?
Yeah, of course. This information is crucial to understanding other topics we'll bring up in this podcast. So DMD is a genetic disorder that mainly affects the muscles by causing muscle weakness and degeneration. What causes this phenotype is a mutation that prevents the production of dystrophin, or the binding of dystrophin to the sarcolemma membrane. Dystrophin is here. Let's see. It is seen in blue. Let's see if I can get this to draw. There we go. Yes, it's here in blue, dystrophin. There you go. And dystrophin is an incredibly important protein. It is a protein that is responsible for making sure that the muscle cells are intact and that the damage that it may experience throughout the years, for whatever reason, is limited.
So you mentioned a lot of the molecular basis for DMD, but who does this mainly affect?
Yeah, so according to the Muscular Dystrophy Association, of the population in the US and Europe, only 6 out of 100,000 people are affected by DMD. And of the rare diseases, this is one of the most prevalent. This disease is mainly seen in boys, but this is primarily due to how it's inherited. The mutation can be seen on the X chromosome, and this mutation is affecting the Duchenne gene, and the mutation is received or inherited recessively. So in this case, say this is the mother, and this is the father, and they have a child. The mother is affected, so she has a mutated gene, but the father is healthy. So why? So now, if the mother has one mutation, one mutated X chromosome, she has half a chance of giving it to her children. And so typically if a child, a female, has one mutated chromosome and the other one is healthy, because females are designated XX as far as sex chromosomes go, the healthy chromosome can help produce enough dystrophin to compensate for the mutated one. However, boys only receive the one X chromosome. And so if they receive the mutated one, then the male will have DMD as a result. He does not have another healthy chromosome, like in the case of a female, to compensate for the mutated one, which is what we can see. So this is the reason why it is more common in males, because they only have the one X chromosome. If that happens to be mutated one, then that is what they will have. They will have DMD.
Wow, that's a lot of very important information I did not know about. Thank you so much for sharing that. Now we know who is affected. So could you please continue by describing some of the symptoms that these individuals experience?
So symptoms of DMD typically present themselves when the child is around 2 to 3 years old, so around that age. And at a young age, they can be seen to have enlarged calves, some cognitive delays, and perhaps may even toe walk. But as time progresses, the child will experience much more muscle loss and weakness, eventually leading to loss of mobility or loss of ambulation. So then they are confined to a wheelchair. Due to this, patients with DMD have a decreased life expectancy and typically die somewhere between the ages of 20 to 30 years old.
Oh my God, that is so severe. It's really, I'm just wondering, I'm lost for words. What are some treatments that could be done to help Duchenne muscular dystrophy patients?
Well, there are a few treatments, but one of the most well-known one and clinically used is the corticosteroid treatment to help prevent muscle damage and ensure that muscles remain flexible. There is also physical therapy that can help with that, some cardiovascular treatments to ensure that the heart, muscles, and function work properly. And this can be through ACE inhibitors or even beta blockers. There's also pulmonary aids such as ventilation. And there are, of course, experimental methods, exon skipping, upregulation of utrophin, dystrophin delivery, and so for you listeners out there, you don't need to remember all this information, but I'm telling you so that you're aware that there are treatment methods and that many different areas of medicine are used in order to help DMD.
Thank you so much for sharing. And now that the audience and all of us are caught up onto what exactly is DMD, let's connect that back to our basic topic. How were DMD patients affected by the pandemic? What were the living situations?
Yeah, so now I don't want to give too much away because I know we'll talk about this later and we'll go more in depth. But this group of individuals are incredibly vulnerable to COVID-19. And this is due to the fact that they have decreased pulmonary function, they have a weaker immune system, and are prone to cardiovascular diseases like cardiomyopathy. And for these reasons and many more, that can cause DMD patients to have a more severe response to COVID-19. So they are more at risk, and it is the community's responsibility to become more aware, work together, to be respectful, safe, and find methods to help these individuals where we can.
Thank you, Adia. That is exactly why this topic is so important and why we felt we needed to discuss this for a community project. I know it has been hard for me specifically during the times of the pandemic and the whole situation. So I can't even imagine how hard it must have been for these DMD patients. Now that we've
Mhm.
learned more about recognizing DMD and its symptoms and important, let's get deeper into the impact that the current pandemic COVID-19 had on these patients. I'm going to be passing on the microphone to Adia, who'll be interviewing MIMG and Major Xuanting to give us a preview on the toll the pandemic took on the patients and their families.
Yeah, so Xuanting, can you give us more information about how did COVID-19 affect DMT patients and their families?
Yeah, thank you for asking. As we all know that the unemployment rate increased dramatically due to the pandemic, and when this happened in a DMD family, it will be devastating. And because there are general truths about the challenges of chronic caregiving, and each caregiving context has its unique challenges. But for DMD family, the challenges of caregiving rise above the challenges of usual parenting, and this is because of the early age diagnosis, since as Adia mentioned above before, that the the DMD patients show their symptom at age of 2 to 3, and DMD patients gradually lost their muscle functions through aging. And more importantly, DMD patients' parents not only need to provide caregiving support, they also need to make money for other expenditures that's related to their children's health. This may include insurance fees and the cost of the medicine, such as steroids, and they also need to purchase mobility equipment like stroller, scooter, power, or wheelchair if their children are in non-ambulatory state. And PPMD did a survey that aimed to understand how the COVID-19 pandemic has affected the DMD community. And the results show that 42% of the respondents report that the pandemic had impacted their job or like financial situation. So the DMD community really having a hard time during the pandemic. So this will definitely put more pressure on the DMD families.
Oh my, that's so sad to hear that. But could you elaborate on PPMD? Like, what is the role in the DMD community? It seems like they're really trying to help.
Yeah, I'm glad to answer this question. So there's a lot of organizations that are there to trying to help the DMD community, and PPMD is one of them. Actually, PPMD stands for Parent Project Muscular Dystrophy. So if you're watching our podcast, you can see on the screen, there's a website right here, but if you're listening to us, their website is www.parentprojectmd.org. So there's a lot of information on their website, such as you can find what is DMD, what caused DMD, what is ongoing research about DMD, and I highly recommend you guys to check it out if I have like if you want to know more about DMD and about the DMD community.
Now, I'm only 22 years old, so I'm not a parent, but I can only imagine from seeing my own parents and others around there that it is one of the hardest things in the world. From what you said, I feel like there are a lot of pressures for DMD patients and their families during the pandemic. Is that right?
Yeah, they really suffer a lot from the pandemic, and in fact, DMD patients and their family members are at increased risks of depression and anxiety. And mental health impacts are likely to be exacerbated due to the pandemic. There are some factors such as disrupting of daily activities, school closures, anxiety, and fear of the situation, like about what's going on during pandemic. And limited availability or lack of mental health service are there. So we're strongly recommended that psychological care and behavioral support can continue through like telehealth, that we can help them to go over this like very hard situation.
Mhm. So you mentioned about the health impacts on DMD families during the pandemic. Does COVID-19 affect DMD patients' health?
Yeah, so as Adia talked before, DMD patients use steroids as their standard treatment to preserve or like prolong their ambulation and trying to delay the loss of muscle strength. So however, the steroid treatment is associated with side effects, such as linear growth failure and excessive weight gain. And additionally, long-term use of steroid can also cause an immunosuppressive effect, which making the long-term user more vulnerable to infection. One more thing I want to mention is that a lot of studies have shown the changes in motor function in DMD patients after travel restriction due to the pandemic. And researchers find that the change in range of motion of ankle dorsiflexion was significantly decreased after the travel restriction. So this reduction is likely to caused by the sedentary lifestyle, and for this DMD patient, they might not have a lot of chance to do their regular physical therapy services.
Wow. Okay, so that was a lot of information that we need to digest. But could you clarify what is the range of motion for the dorsiflexion, and why is this important for DMD patients?
Yeah, of course. Dorsiflexion is very important because it allows the tibia to move forward freely. And if the tibia is stuck in like vertical position, which is like 0 degree, is very good, but it can cause like the top of our body to lean forward to make up the lack of mobility in ankle when squatting. So due to the impact of pandemic, the causes of DMD patients' range of motion of dorsiflexion to like decrease dramatically. And as you can see on the graph, so for this, the normal range is about 20 degrees. But for the DMD patient, they'll have like roughly 0 degree. You can see it's very flat. Right?
That was some awesome information. Now I want to go into something else. I know that Jandine has mentioned how during the pandemic, many DMD patients have moved to a more virtual platform. Can you go further into detail? DMD is a serious issue, and it's hard to imagine that they can get the care they need without meeting their medical physicians in person.
Yes, now, although not a lot is known about how many treatments, such as corticosteroids or ACE inhibitors, may react or affect an individual if they contract COVID, healthcare professionals still recommend that they remain isolated and then continue to receive their treatment regimen. If a home visit is absolutely necessary, healthcare workers will wear proper personal protective equipment or PPE. Some examples of that can be seen here with the mask, which I know many of you are familiar with, some face shields, gloves, and maybe even a gown. And so they will also be pre-screened for COVID, but otherwise treatments have moved to video, either pre-recorded or live, online communication, and even telephone appointments. So for instance, if a patient was they had physical therapy before COVID, but now COVID's hit, they are still able to continue their treatment through video conferencing calls. And I would like to note that depending on the age of the child and stage in the disease, caregiver assistance may be necessary. And so it's important that patients, the family, caretakers, that they all adjust to the remote mode of therapy to ensure that DMD patients still get the treatment they need, even while at home because of the pandemic.
That sounds great, really advanced and organized, but I still can't wrap my mind around it. Like, please explain to me, how can, for example, pulmonary function be monitored while a DMD patient is at home during the pandemic? I don't understand.
So it's actually highly possible. A 2021 study actually investigated this exact question. And so in this particular study, they all gave their participants with DMD a portable machine that can measure pulmonary function. Overall, what they concluded from the study was that there was minimal to no significant difference between the home and hospital readings for pulmonary functions. And for those of you who are watching the video, here you can see the home versus hospital, and the numbers aren't really that different. And so most participants were satisfied with the at-home measurement tool and explained that reasons for irregular measurements were mainly due to forgetting, seen here with the 43%. 14% said that it was difficult to use it. 14 again said lack of time, 29% lack of motivation. And so what researchers mentioned is that this mode is effective, but it should be also introduced to children at a younger age so that they are more likely to use the device and they become more familiar with it. That way it's just part of their daily routine.
Wow, that is a great find. Hopefully, as time progresses, other devices and therapies can be developed and enhance home treatment for DMD patients just to make their lifestyle a little bit easier, minimize the visits to the doctor, and I don't know, just alleviate some of that stress that they have to keep track of their appointments.
Yeah. So now we're going to switch gears a little bit and we're going to talk about one of the most important topics, one of the most talked about since the pandemic began, which is vaccination and overall vaccines. So Melissa is our expert on vaccines and DMD patients, and so I will pass the mic over to her.
Hey guys, and welcome to the Clash of the Titans as DMD comes head to head with COVID-19. Unless you've been living under a rock lately, everyone knows that if you're not vaxxed, you're just not welcome anywhere. And that's a hard truth. Whether you're anti or pro-vaccine, it doesn't matter, as guidelines will not allow anyone who is not vaccinated or does not have a negative COVID test to enter any site. What one wants a human normality to just stroll in the supermarket or visit a restaurant, cafe, is no longer, as everything requires precaution and documentation, such as vaccination cards. But what about special cases? Have we stopped to consider if vaccination is the best option for people who suffer from autoimmune diseases, neurological diseases, and neuromuscular diseases?
So Melissa, I was wondering, like, around what time did DMD patients get vaccinated, and did they really get vaccinated at all?
So nothing with DMD is straightforward or easy or a yes or no answer. Everything is calculated and timed, and the vaccines are no exception. Patients with DMD who require respiratory support and who are receiving deflazacort or prednisone will require additional counseling on efficacy and timing of their vaccine, depending on their treatment. In other words, what I'm trying to say is that if the medical regimen that a DMD patient is on is full of steroids, as the ones I mentioned before, it is highly likely that they will not be able to receive the vaccine. They will be severely immunocompromised. And not only that, studies have shown that chronic steroid use is believed to diminish the vaccination response. So everything comes down to what kind of medication that person is taking, how often are they taking, how much of it they're taking to determine the time frame window for vaccinations. This is extremely important in order to avoid harmful side effects, such as further deterioration of respiratory function caused by further damage and weakness to the muscle.
I had no idea about the importance of this time frame for DMD patients. So what about the vaccination types? Is there a preferred vaccination?
So I want to apologize in advance to the audience, as again, I don't have a straight answer. So the problem is that due to the rapid development of these vaccines to combat the COVID-19, there was just no way that immunocompromised patients, such as DMD patients, MS patients, could have been included in these clinical trials and data to be collected. So I can't really say which vaccine is best, as just there's no data to support my argument. However, the efficacy of the vaccine, as I said before, it does depend on the drugs you're taking and when exactly they're taking the vaccine to carry out this effect. Due to the safety issues with it, a lot of individuals will not be involved in the clinical trials in the future either. So I'm not sure if we're ever going to have a straightforward data suggesting a single vaccine for the DMD patients.
Okay, so it sounds like it's a great area of vaccinating DMD patients, but wouldn't it just be easier to leave them unvaccinated, as it's also such a rare disease that it will not have an impact on herd immunity? So if they were left unvaccinated?
So that's kind of like the other side of the stick that I was referring to. So even though there are possible side effects or possible risks of taking the vaccine, there's also equivalent, if not even worse, risks of not taking the vaccines and contracting COVID-19. So again, it's a gray area, and I guess it does depend on the person, on the individual with the DMD, and of his caregivers, what they prefer, how they will balance out the two negatives. And hopefully, wherever they get COVID-19 or they get the vaccine, they will be just fine. It's just there's not enough information to back up this answer. Again, apologize for this.
Yeah, I see what you're saying. But has there been any data regarding DMD patients getting infected while they're unvaccinated?
Yes, there has been some data, and the mean average person getting vaccinated was of age 9. Thank God, these people that did get COVID-19, excuse me. So yeah, these people that did get COVID-19, thank God, just exhibited cough. They just exhibited cold symptoms and flu symptoms that just were not that variable when you compare them with non-DMD students, with the non-DMD patients. However, as they got older, more severe symptoms did exhibit in older patients that did require hospitalization.
So interesting to hear. So do you think the fact that younger DMD patients being symptomatic but now in bad shape with getting infected with COVID-19 made their parents more skeptical about vaccinating them?
Yes, for sure. So I said before, it is a gray area, and seems like we don't know the side effects of getting the vaccine, and that younger patients with DMD in the sample size that we have did show just a headache, sore throat, muscle pain, fever, and cough. it is likely that they would just prefer the natural vaccine, which is actually getting COVID, than the actual vaccine. But as I said before, this is just for young children.
Okay, and thank you for sharing, but I have one more question for you. So are there any specific guideline or recommendation you would like to give our audience?
Yes. So if you're a DMD patient and you're gonna go get your vaccination, just make sure that the healthcare provider there knows you have DMD. It has been shown that DMD patients react better to having the vaccine not in their arm, injecting their arm. This is mainly because the muscle in the arm is just too fragile to sustain such an infection, so injection. So if you are a DMD patient, I would suggest just telling them that, and they should give you the vaccination through the thigh. Also, it is very important that you know all the risks when taking the vaccine. Having full information gives a more informed consent and better overview of what you're getting yourself into. And thank you guys so much for listening to our podcast. We hope that these were super helpful, that we got you aware of DMD, of the impact it has, of how it relates to COVID, and that if you know someone with DMD or have friends who have friends with DMD and family, that you do share our podcast with them to get them informed. And we are really happy that you got to listen to it. And we really, really, really hope you enjoyed it and learned something from it. Thank you so, so much.